KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Alice Wertz. Childhood trauma and stress have been known to cause health issues in young and midlife adults. But according to a recently published study out of UCSF, researchers can now link adverse childhood experiences to health consequences that can last a lifetime. Our guest today is Dr. Alison Huang. She's a senior author of this study that we'll be speaking about today. It was recently published in the Journal of General Internal Medicine, and she's also the Director of Research in the Division of General Internal Medicine at UCSF. Thank you so much for joining us today, Dr. Huang.
Thank you very much for having me. It's terrific to be able to speak about this research.
It's very important. Tell us about the study. Who are the participants?
Great. So first, let me just say I'm delighted to speak to you today on behalf of our whole research team. It includes many other terrific researchers at UCSF, Victoria Lee, our first author, Anita Hargrave, Nadja Lisha, all of us with connections to general internal medicine at UCSF. So we were analyzing data from a national sample of women and men recruited across the United States and across the full aging spectrum. So these were women and men. In our study, we're focusing on those age 50 and older, going up close to age 100, who took part in interviews and completed assessments and underwent cognitive and physical function testing in their homes as part of the National Social Life Health and Aging Project. This is a cohort study designed to observe adults across the aging spectrum and get information from them about the social factors and the health-related factors and the environmental factors that could affect health and functioning across older age.
What did you find?
So first, we found that over 40% of the women and men in the study recalled one or more significant adverse childhood experiences. So experiences like being exposed to violence, directly experienced violence as children, witnessing violence as children, being under severe financial strain or stress in their families as children, being separated from parents when they were children. Nearly half, right, of these older adults could recall these kinds of severe, stressful, or even traumatic experiences when they were young. And then on top of it, the women and men who did recall these experiences, they had clear objective signs of greater physical mobility impairment, cognitive impairment in older age. So they underwent testing of their ability to walk and rise repeatedly from a chair and do balance stands. They had tests of their memory and mental concentration, and there were just significant differences among those who had childhood experiences that were stressful or traumatic versus those who did not.
Does this have implications for public health in general, or what are some of the takeaways?
Sure. Well, I think right now there is growing concern and appreciation for the health implications of adverse childhood experiences. Where California is sort of the first state in the nation to have mandated commercial insurance coverage for screening for adverse childhood experiences, and at least children or younger or midlife adults. Our study may be the first, if not, or at least one of the first, right, to provide sort of direct objective evidence that these adverse childhood experiences, these ACEs, have implications for health and functioning across the full aging spectrum. One of the first to provide evidence that older adults with experiences, they do have differences in their memory in older age, in their physical mobility over age, and also what we call functional disability, whether they're able to carry out activities of daily living without assistance from others, and their ability to stay safely in their homes and not need care or be at risk for needing to go to long-term care and nursing home facilities. And so I think this study takes the already important issue at adverse childhood experiences and really makes us think, oh gosh, should we be thinking about implications across the full lifespan, thinking about implications for adults who are trying to age safely and comfortably, 40, 50, 60, 70 years later.
And what does the research, how can it play into the practice of medicine, or how patients can be helpful in providing their doctors and physicians with information to help in their health care?
That's a great question. So, I think a challenge in healthcare in general, right, is that we are usually so siloed, right? Pediatricians and some family doctors take care of children. Adult internal medicine physicians and geriatricians take care of older adults. And we don't have a lot of crosstalk between medical specialties. I think that clinicians taking care of children are focused on what's going on in the immediate childhood period and don't necessarily think about what the implications are going to be 50, 60, 70 years later. And then on the flip side, clinicians taking care of older adults, aren't necessarily never think to ask or wonder or speculate what happened to their older adult patient, decades earlier when they were children. So on the one hand, I think one important takeaway from the study is that we kind of need to move beyond these clinician specialty lines and really adopt a more kind of lifespan approach to health. We need to think a little bit more about the kind of implications and interconnectedness of stress and trauma across the whole lifespan. And along with that, it sort of raises the question, like when we're seeing a patient in front of us who is in their 50s, 60s, 70s, 80s, 90s, should we be starting to ask about their childhood experiences? Are there things that people could tell us about how the stress or trauma that they had as children is affecting how they're experiencing their health problems in older age?
It's certainly intriguing in terms of how many people in the study, 40%. It's kind of an indicator that if we think about the population in general, what a large portion of our population could potentially have been exposed to adverse childhood experiences. And for the greater good of the population, how important it is for family health. Any thoughts on that?
I agree. And, interestingly, as high as the number was in this sample, I think 44% of our participants reporting these experiences, there have been other studies that suggest that, the prevalence of ACEs is even higher in the U.S. That numbers from the CDC and other groups come saying that it could be as high as 60% of U.S. residents who meet criteria for having had at least one kind of adverse childhood experience, one kind of unusually stressful or traumatic experience in childhood. So I agree. On a larger level, if we want to prevent these experiences and we want to prevent the health-related consequences, sequelae of those things, that we need to start with what is happening in childhood, family life, community life that is exposing people to these events so early in their lives.
Yeah, lots more to learn from this, definitely. Thank you so much for joining us today, Dr. Huang.
Thank you so much for having me. It's a delight to have been able to talk to you today.
Our guest today on As Prescribed, Dr. Alison Huang, senior author of the study, which was recently published in the Journal of General Internal Medicine. She's also the director of research in the Division of General Internal Medicine at UCSF Health. I'm Alice Wertz. You've been tuning in to As Prescribed.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 and AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.